However, over here, we see another plaque which is not calcified, and it's actually composed of fatty plaque, and there's actually a little bit more significant stenosis here. So what we do is, again, take non-contrast enhanced images followed by contrast enhanced images to evaluate the plaque. Now, over here, I just have a little bit of a chart talking about the significance of the amount of calcium that somebody might have in the coronary arteries. The more calcium you have, the more likelihood you're going to have a significant lesion in your coronary artery. Now, other technical limitations that we might encounter during the study is, again, what I had mentioned before about arrhythmia. People who, for example, have irregular heart rate, when we see these images, you can see there's these little lines going through the picture, and that might create problems in interpretation. So that's why typically we don't like to perform these studies on people who have an irregular heart rate. However, I will say that we do have software that helps improve images that do show what we call a step-ladder artifact. We have software to improve those images in case we run into the situation. Now, this is a beautiful example of what we're able to do nowadays. We have a 3D reconstruction of the heart and the coronary arteries on your left, and you can see over here these coronary arteries are beautifully shown, and as you can see here in this proximal left anterior descending coronary artery, which is one of the 3 big arteries in your heart, there's a significant stenosis here. Now, here we show the coronary catheter angiogram picture. Okay, so this is a non-invasive picture. This is an invasive picture. So again, I'm stressing the non-invasive imaging that we are able to obtain today. Here, again, we see a picture of a CAT scan obtained with a 64-slide scanner, and we can see here that this is the normal lumen of the coronary artery, and as we go farther out, there is a severe luminal stenosis here, or narrowing, which is causing chest pain on this patient and potentially might lead to a heart attack. And there is significant plaque basically seen all along this coronary artery. Here we see the invasive imaging, which shows the significant stenosis here. Now, what I want to mention is that even though we are able to see this non-invasively, obviously we can't perform any interventions. So many times when we see this lesion, automatically the patient needs to go and get this procedure because they need to be intervened with a coronary artery stent or angioplasty, or depending on how severe the lesions are and how many there are, the patient might actually need a bypass procedure. This is just an example of a diseased artery, what we call a dissection, where there is a little bit of a tear in the wall of the artery. The reason I'm showing this is because of the exquisite detail that we can see nowadays with the CT scanner. And essentially there's this little black line running along the coronary artery here, and that's the intimal flap showing the dissection. And here is, again, the non-invasive procedure with CT, and here's a coronary catheter angiogram showing the same thing. Now, other things we can visualize with cardiac CT are coronary stents. Here's a 3D reconstruction of the heart. Here's the coronary artery, and you can see this metal stent in the coronary artery on the 3D display. And then on what we call a multiplanar reconstruction, we can actually see the coronary itself as well in a thinner section. For example, here we have a patient who's had a stent. Actually, he's had 2 stents. One is over here, more proximally in the right coronary artery, and the other one is more distally. But what you can see here is that there's a severe stenosis above the stent, which is actually a very common place to have stenosis, not necessarily inside, but actually either above or below. And here we see the non-invasive picture, and here we see the invasive picture. Here is just another reason why we might be able to do coronary artery imaging with CT, is to evaluate for anomalous coronary arteries. Essentially, we have the right and left coronary